Hi guys, my name is Rosalinda. Today my project will be Indiana Maternal Health Inequalities. Addressing the policy level is that maternal health inequality in Indiana is not just a healthcare issue, it is a social justice issue. Black and indigenous women as well as those from low-income communities face significantly higher rate of maternal mortality and morbidity than white women. This disparity are not due to genetic or lifestyle choices alone. They are largely driven by institutional communities. This group often lack access to quality maternal care, face biases in the healthcare systems. Nonprofit organization is that IPQIC is a nonprofit organization working especially to improve the health of mothers and babies in Indiana. They use data to understand where the healthcare system is failing and how to fix it. Their mission is centered around quality improvement, not just identifying problems, but implementing real solutions through healthcare providers' trainings. Their core audience included healthcare system, birth worker, public health official, and importantly, community organizations that are connected directly with at-risk populations. How IPQSC address the issues that they do a data-driven effort where they collect data from hospital and health system across the state, identifying pattern and disparity in maternal health outcomes. They use this information to make evidence-based recommendations on how to improve cares. Also, community outreach. They engage with women directly through educational campaigns and workshops about maternal cares, warning signs of complication and how care is provided. They also provided training to reduce implicit biases among healthcare professionals. IPQSC accomplishment is that they raise awareness that has succeeded in getting maternal health disparity recognized as a public health crisis in Indiana. Also, they strengthen local partnership, where they build network of hospital, clinic, and grassroots group that work together to close gap in care, something that doesn't exist in this way of a few years ago. Future aim of IPQIC is that they do a legislative advocacy where they influence policy to extend the Medicare coverage for postpartum care from 60 days to at least 1 year. This will ensure women don't fall through the cracks right after giving birth. And they also do service expansions, launch program in rural Indiana where access to hospital. This included telehealth support, mobile clinic, and strengthening the workforce and community health workers. IPQSC approaches that the grassroots is that they work with communities directly mothers, local nonprofit to provide education, resource, and care. They listen to those most impacted by the system. The top down is that they operate at the state level, advocating for change in Medicaid policy, hospital, and maternal health legislations. Other states that do also the same program is that California. They do a dramatic progress by implementing program like the California Maternal Quality Care Collaborative. They expanded Medicaid coverage, provided implicit biases training to healthcare providers, support community health initiatives. Also, New York. They do a maternal mortality review board and increase funding for midwifery and community health. They also invested in culturally responsive care program, ensuring women feel respected and safe during their birth experience. Is there a window of opportunity to act now? Yes, there is. There is a national focus. It became the national conversation with the U.S. Congress, media, and public health agency acknowledging the crisis, particularly racial disparity. Also, political momentum in Indiana. They do policymakers in Indiana are increasingly aware of this issue. Some are already considering bill to extend Medicaid coverage and fund maternal health programs. In conclusion, why act now? In Indiana has once in a generation opportunity to address a maternal health crisis with data policy support. They also start with Medicaid expansions for postpartum care is simple cost effective. Also, they invested in community led programs. They meet women where they are in rural and urban areas. And that is my reference page. Thank you.